my Lord, I am on the battlefield for my Lord, and I promised him that I would serve him till I die. I am on the battlefield for my Lord.
Greetings, friends and neighbors. This is Joseph. I'm the head waiter at Life Source, and I want to talk a bit about a tough subject that's a little controversial and maybe for some people a little sensitive and painful. But what we're going to talk about is life-threatening or terminal diseases, and I feel like I'm led to share this video to bring it right to everyone's review. So here's the deal. A friend of mine invited me to go with him to meet with a doctor regarding a health situation that they wanted to talk to him about, that the doctor wanted to discuss. And actually he invited three of us to go with him to the doctor. And I think he suspected the news was bad, and maybe the doctors had given him a hint, but he had asked them to wait till he had some folks around him who he thought cared about his health and his welfare. And as simple as that seems, I'm going to say this in this short break. There are a lot of people who have no one with whom to share what someone once said to me was difficult news. And difficult news, takes a lot of phases. You're being kicked out of your home, you're being fired from a job, you're being thrown out of a school. But the really difficult news usually revolves around the subject of life and death. That's difficult news, especially when it's coming from a medical professional. And so, yeah, this was proved to be a difficult news situation. The doctor brought us all in, and after a few minutes of meeting everyone, he then brought in his supervisor who's actually came in from another university, hospital program, to be part of the discussion. And so they walked through a string of tests and things they had performed, tests they had reperformed, and it validated and confirmed. They walked through discussions they had with other doctors because it was pretty serious. They ended really the discussion by saying to my friend that he had really less than 3 months to live based on their diagnosis. Their prognosis was not good at all. The two other friends who were with us in the room, they began falling apart immediately, and that's certainly understandable. But he and I, we sort of sat there looking back and forth at each other, just quietly. Everyone asked questions, really except me. I didn't really have any questions. I was just thinking about it all, taking it all in. As much as I like to talk and carry on and fuss and fret and jump and holler and all those things, there are just times when, with all that going on, I don't care how entertaining it is, I just sort of sit or stand or lay silently and watch. And this was just one of those moments for me. So while everyone asked all kinds of important and critical questions, and they were, the doctors really let him know that they were surprised he was alive to talk at that point, that he was even capable to engage. And that was part of the reason for their testing. As traumatic and disturbing as their findings were, he was still up and engaging fairly normally, with just a little bit of pain. And so they told him their prognosis, and they were even somewhat teary-eyed. The thing is, this discussion reminds me that sometimes doctors appear to be cold and distant, certainly on television and in movies. And I've met some who, could lay out facts of life and death and pain and suffering without the slightest bit of emotion. And I understand that. It's painful. It's painful for all of us to deal with suffering and death, and so we put up shields to protect ourselves from having to deal with it mentally and emotionally, and that's normal. But these doctors weren't like that. They were quite open with their emotions. They were clearly disturbed. My friend's doctor was quite emotional about the whole thing in retrospect. But essentially, that was the bad news, that he had easily less than 3 months. If he lived 2 weeks, they would be surprised. And so they left the room, and after answering everyone's questions, and then after we all sat and the crying sort of took a lull among my other two friends, I asked if I could sit with my friend who was being treated. If we could sit together and chat. And so they left the room, and he looked at me and I looked at him, and he leaned forward and said, "So what do you think?" I broke out laughing. And then so did he. I mean, we just rolled on the floor, both of us. He rolled off the bed that they had, that he was sitting on, and I rolled out of the chair, and we I leaned up against the door, and he leaned up against one of the cabinets, and we just laughed. And I said, "That was terrible news. That was insanely horrific." And we laughed another 4 or 5 minutes as we talked about how sad the doctors were, how the crying started almost immediately. My other friends who were there, they're probably a little surprised at this, but they understand. It was tough, and so it was for us our way of dealing with that extremely difficult news. So anyway, he got back up on the bed, and I got back up on the chair, and he said, "So, what do you think happens from here?" I leaned forward toward him and I said, "I only know one God who deals with life and death. I only know one God, and this is the time to talk from that God's perspective. God alone gives life, and God alone allows death. I think we say to ourselves that medical science and the healing arts and the medical arts, or whatever you want to call it, that all that's involved in all of doctors and healing and the medical profession and all of that, fine, but God is the last word. To be clear, I am an abortion. That was what my mother was told when she was pregnant with me at 5 months. The doctors assured her. Specialists came in from around the country. They told her parents and anyone who would listen that she was carrying a dead lump of flesh that was going to poison and kill her if she didn't get it out of her system. That piece of poisonous flesh is me. No, I didn't kill her. She's alive and well even now, having retired from ministry these last couple of years. But my point is that they had already decided. Their prognosis was terrible. It was the worst you can imagine as a pregnant mother looking forward to what came to be her little chocolate child. But she said that she heard a voice that told her I was fine, and that the baby inside her was going to come out just okay. So she went with that voice, despite terrible warnings, desperate warnings from my grandparents who were afraid for her life. And she was sick as well. She was very sick in the course of the pregnancy. So it happened that, as God would have it, that I was born alive and well at 7 months. I weighed 8 pounds 11 ounces, according to my mother and my grandparents. But that being said, that established sort of my view of the practice of medicine, and it establishes and maintains my view now. Doctors say and promise and prognosticate what they will and diagnose what they will. I absolutely am firm with everyone that God has the first and the last word in the discussion, and I have been proven right on quite a few occasions. You can be sure of that one, but that's for another video. So I told my friend some of these things, and then I said to him, here's what you need to make up your mind to do, and this is my best counsel. Fight. If God has you alive, even when doctors have decided that you should die or be dead, then there's a reason. There is something that you have to get done, something you have to achieve, something marvelous and important, something major. And it may not seem like anything big to you. You may not even know what it is, and that's okay. Sometimes it's just being there to chat or help with someone else who's in another fight that may not be life and death, but just your piece of contribution will change things for them and everyone else who engages with them forever. Sometimes it's a little thing like, hey there, how you doing? And sometimes it's something big. You don't need to necessarily turn your life upside down. You don't need to run to the church and run to the closet with the priest to try to figure out what it is. My number one thing is talk to God about it. And fight to live until God says stop living. And believe me, when it's time, God will say stop living. You won't have to guess at that. And because of that, you don't have to worry about that. You just have to worry about living. You just have to worry about doing what it takes, taking the medicine, taking the chemotherapy, taking the radiation, if that's what you're doing, taking the herbs or eating the right foods, or getting up in the morning and getting out of bed if you can, and going for walks, or whatever it is you've decided to do, you've agreed upon that you're going to do to improve your life, to improve your chances of survival, of increasing your longevity. Whatever that is, do that. But hear God. Because if God says you are living, if God says it's time to live, live. Until God says stop. Not till your mother says stop. Not till your father says stop. Not even till the doctor says stop. That is a waste of your time. What is a more positive use of your time is doing what it takes to live a life that matters. From this point going forward, to take deep breaths, to enjoy the next step that you can, whether it's 1 or 2 or a crawl or whatever it is. Trust God. Look to God and live until God says stop living. And that's what I told him. He didn't live 3 months. He lived almost 6 months. And I'm going to be straight with you. The only reason he didn't live past 6 months was because his treatment program was going so well, he decided to ratchet it up against the best advice of everyone who knew him, including me. His last words to me before he began ratcheting up his treatment was, I understand what you said, and I've decided this is what I'm going to do no matter what happens. We all get to choose, but his treatment program was going well, and he made the decision he made. It wasn't the cancer that killed him. As Neo says in the Matrix, the problem is choice. And that's okay too. We all get to choose. But my encouragement, my warning, my discussion here is listen to God and talk to God about whatever it is you're doing if you want to live. And of course, at the bottom of this, if you are in the fight with cancer or heart disease or whatever it is, whatever stage the doctors said you were in, I've heard them all. And the great news is I've seen people recover amazingly when doctors have declared, there's no way. We can't go any further. Blind the rest of his life. She's never going to get out of the chair. She's never going to live. That can't be cured. There's no cure for that. That requires a surgery. We get on and on and on and on. He's never going to get out of that bed. I've heard all of that. I've walked into hospital rooms where doctors have quite flatly said, he or she is going to, they're going away any day, any moment now. We're just, waiting for that last breath. And that person didn't just not breathe their last breath. Heck, they were at home. Some of them went back to work. Some of them went traveling. Some of them did things with families. Years later, after the doctor says, we're just waiting for that last breath. You don't get to do that. You don't get to decide that. God decides that. That's my word to all of you, or any of you who can hear this. Fight. Talk to God about it. Here's a piece that's important. Jesus says to his disciples, in fact, he pushes it on them. He pressures them with it. If you ask for anything in my name, after my standard, meaning after my perspective, after my view, from my position, my Father will do it. Ask, he says. The number of people who I meet who refuse to just ask God for life is amazing. I don't know whether it's ego or shock or whatever it is, but ask. Ask God for it. If he does not give it, he is still God. If he does not give it, He is still God. And trust me, He has a really good reason for not doing it. The fact that we can't see it says that we're not God. But at least I want to just beg you, ask. And while you're asking, fight. Fight to live. And while you're fighting to live, try to be the difference for someone else. Because if you're alive, God intends for you to be the difference for someone, somewhere, somehow. Please think about that. While you're struggling with AIDS, or struggling with your heart disease, or struggling with the cancer, whatever kind it is, or struggling with whatever life and death fight. Fine, you're on death row, and you've got a reprieve. Go with that. Fight to live. No matter what heck, if you are a doctor, fight to live. And trust God for your life. That's what this video is about. That's all I'm asking. That's my presentation. My name is Joseph. If you have no one else to share with, or to go to a doctor with, or to talk with, or to pray with, call me, ping me, email me. If I can come there, I'll make it. If I can send someone, I'll send them. But at the very least, we can talk to God together, and I can encourage you to fight. That's what God wants. That's what God wants. He gave us life for a reason. And today is a great day to live. Thanks for listening.